Hello, my name is Aaron Petra. I'm a physician assistant working at the Institute for Minimally Invasive Spine Surgery in Holyoke, Massachusetts. We operate out of Holyoke Medical Center with our attending neurosurgeon, Dr. Pennings, and today we're going to be talking about a minimally invasive endoscopic discectomy. So here we have an image of a sagittal and axial view of a lumbar MRI. If you look at the image on the left, there's a large disc herniation seen on sagittal imaging. And on the image on the right, we can see that disc herniation is compressing on the right-sided nerve root. So some potential benefits of surgery: resolution of severe leg pain that often accompanies disc herniations, resolution of numbness and tingling in the legs, improved gait, and improved strength. The expected hospital course. So you'll arrive the day of surgery, you'll check in with our preoperative department, and you'll meet our nursing staff. You'll see Dr. Pennings before surgery, and you'll sign a surgical consent form. You'll get to meet our anesthesia team and make sure that you're safe to go under for surgery. And after your procedure is done, you'll wake up in the PACU, our post-anesthesia care unit, and then usually you're able to discharge home within an hour or two after you're stabilized and woken up. For the surgical procedure itself, after intubation, we place you on a Wilson frame. We sterilize the surgical site with iodine, and we take a timeout to confirm patient information and to review the proposed procedure. For the surgical approach, we make a very small incision for endoscopic surgery, only about the size of about 1 to 2 centimeters. And then the endoscope is brought in. And this is the actual device on the right-hand side that Dr. Pennings will use to perform the surgery. For the surgical approach, it can be done in both a translaminar or a transforaminal approach. On the left-hand side, we see a translaminar approach where we go straight down from the back and go through the lamina bone to access the disc herniation. Sometimes disc herniations are more off to the side, and a transforaminal, or the foramen where the nerve passes through, approach is used to access these types of disc herniations. After the disc herniation is located with the endoscope, Dr. Pennings will remove the excess disc material using small instruments that can fit through that little endoscope opening. After the disc herniation is removed and the surgery is complete, we'll place subcutaneous sutures underneath the skin that will absorb on their own over the course of the next few weeks. On top of the skin, you'll have some steri strips with a bandage, and the steri strips can be removed within the first 7 days after surgery if they don't fall off on their own. For recovery and follow-up, the bandage gets removed on post-op day 1, so the day after surgery. You can also shower the day after surgery. Steri strips stay on for a week. Observe about an 8 to 12 pound weight restriction for the first 6 to 8 weeks after surgery. Limit bending, lifting, and twisting. Walk as much as you can, and try to get back into regular activities of daily living slowly in a stepwise approach. Utilize over-the-counter medications like Tylenol or ibuprofen, alongside narcotic pain control that we prescribe after surgery for pain. After this, you're going to follow up with us in clinic in 2 to 3 weeks for your first post-op appointment for an incision check and to see if you need any medication refills. All right, and that is our overview for the minimally invasive endoscopic discectomy. If you have any questions, please feel free to call our clinic and reach out for a follow-up appointment. Thank you. Bye-bye.